Hi there. If you or someone you love is facing radiation for breast cancer, this is for you. We're going to walk through this whole journey together step by step to give you a really clear idea of what's ahead. Let's start with the most important thing to know right from the get-go.
Right off the bat, I want you to hear this. Radiation therapy is a safe, effective, and totally personalized treatment. It's a standard and really crucial part of the healing process for so many people. All right, so let's dive into the why and the how. The main goal here is simple but incredibly powerful: to make sure that after surgery, the cancer doesn't come back. You can think of it as a crucial safety net for your long-term health.
So, what is it exactly? Well, imagine a super focused cleanup crew. After surgery gets rid of the tumor, radiation comes in with these high energy rays to zap any tiny invisible cancer cells that might be hanging around. And the whole point of this is to dramatically lower the chances of that cancer ever returning. Now, this is really important. Your treatment isn't one size fits all. It's totally customized for you. For most people, that means whole breast radiation, which treats the entire breast area over about 3 to 6 weeks. But for some specific early-stage cancers, there's a much shorter option called partial breast radiation. It's just 5 days and focuses only on the spot where the tumor was.
And here's the best part: no matter which approach your team recommends, modern radiation is incredibly precise. The technology is so advanced now that it can shape the beams to match the target area perfectly, which means it protects your healthy tissues, like your heart and lungs, from unnecessary exposure. So how in the world do they create a plan that's so perfectly tailored to you? Well, it all happens during what's called the planning journey, and it's a really meticulous process designed to make sure your treatment is as safe and effective as it can possibly be. It all kicks off with a consultation with your radiation oncologist. After that, you'll have something called a CT simulation, which is basically a mapping session for your body. Using those images, a whole team of experts, we're talking physicists and dosimetrists, designs a 3D plan to aim that radiation with absolute pinpoint accuracy. So what's that simulation appointment actually like? Well, they'll get you comfortable on a table, usually on your back with your arm raised up, the exact same way you'll be for your treatments. Then the team will place a few tiny permanent marks on your skin. They look like little freckles. And honestly, these marks are like a GPS for the treatment machine. They ensure that every single day, the radiation is aimed at the exact same spot, perfectly. And here's another amazing example of how they prioritize your safety. If your cancer is in your left breast, your team will probably teach you a simple breathing trick called deep inspiration breath hold, or DIBH. All it is taking a deep breath and holding it for a few seconds during the treatment. When you do that, your heart naturally moves down and out of the way of the radiation. It's a simple but brilliant way to add an extra layer of protection. Okay, so your plan is all set. What's the daily routine actually like? I know this is the part that can cause a lot of anxiety, but the reality is often so much more manageable than people imagine. For starters, your entire daily appointment, from the moment you walk in the door to the moment you leave, is usually pretty quick. We're talking just 15 to 30 minutes. But get this, most of that time is just spent getting you into the perfect position using those little GPS marks we talked about. The actual radiation, when the beam is on, that literally just lasts for a couple of minutes. It's incredibly fast. And let's get right to the number one question. Does it hurt? The answer is a clear and simple no. The whole experience is completely painless. You can't see it, you can't hear it, and you definitely can't feel it. It's a lot like getting a normal X-ray. Okay, another huge myth we need to bust right now. You are not radioactive after treatment. The energy from the beam passes through your body. It doesn't stay there. So you can and absolutely should go home and hug your kids, your partner, your grandkids, and your pets. It is completely safe. So the treatment itself is quick and painless. But what about afterwards? Let's talk about healing, side effects, and what you can expect on your recovery path. Side effects tend to build up gradually. You probably won't notice much of anything for the first week or two. Then you might start to see some skin irritation, kind of like a sunburn, which usually peaks toward the end of your treatment. But the most important thing to know is that they almost always start getting better within just a couple of weeks after you're all done.
So what are these common side effects? Well, the biggest one is that sunburn-like skin irritation. Feeling tired is also really common, a mild to moderate fatigue. Some people also notice some swelling or a feeling of fullness in the breast.
And remember, your team is checking in with you every week. They'll give you creams and tons of advice to help you manage all of it.
And what about down the road? Well, this is the great news. Because of how precise and targeted these modern techniques are, serious long-term side effects are actually pretty uncommon now. It's a huge step forward in making treatment safer for everyone. And this brings us to a final and maybe the most crucial point. Through this whole process, from that first planning day to your last day of treatment and beyond, please remember this: you are not alone in this, not even for a second. You have an entire village of people in your corner. Of course, there are your doctors and the therapists who see you every day, but there are also nurses, nutritionists, social workers, a whole team of specialists whose only job is to help you feel as good as possible through all of this. Now, being part of the team means knowing when to raise your hand and ask for help. It is so important to call your care team right away if you notice any of these things: skin that blisters, any new swelling, or pain that seems to be getting worse. Please don't wait for your next appointment. They want to hear from you. We really hope this guide has helped pull back the curtain and demystify the process for you. Radiation is a proven, powerful, and truly personalized tool in treating breast cancer. So as we close, just remember to be an active voice on your own care team. And the next step is yours. So, what questions will you ask them?